Hello medicos, welcome to the lecture on breast anatomy. Today we will cover the essential structure, functions and clinical relevance of the breast, knowledge that is vital for your medical studies and future practice. From the basic anatomy to its implications in clinical settings, this video will provide you with a clear understanding of this important topic. Let's dive in and explore the anatomy of breast. So breast is very important topic at the exam point of view. So let's get focused and start studying. It is a modified sweat gland. Its situation and extent. Situation: it is present in superficial fascia except its tail. Tail is present in deep fascia. It pierces deep fascia through foramen of Langer, and as seen in the diagram. And after piercing from the foramen of Langer, it is known as axillary tail of Spence. Now, extent: vertically it is from second rib to the sixth rib, while horizontally it is from lateral border of sternum to mid axillary line. Relation: superficially it is skin and superficial fascia, while deep relations include one fascia, three muscles, and one space. The fascia is named as pectoral fascia as seen in the diagram, and three muscles, which include pectoralis major, serratus anterior, and external oblique. The space in front of the pectoral fascia is known as retromammary space, which allows free movement of breast on pectoral fascia. It is traversed by lymph nodes and blood vessels. Breast prostatists are placed here. Now, the structures of breast include skin, stroma, and parenchyma. Skin includes nipple and areola, while parenchyma is glandular tissue. Let's get started with nipple. Nipple: it is present in the fourth intercostal space, contains smooth muscle fiber, and it is richly innervated by sensory nerves. It is pierced by 10 to 15 lactiferous ducts. Now, areola. Areola is darkly pigmented. It contains large number of modified sebaceous gland. Sebaceous gland prevent drying and cracking of the areola and the nipple. It gets enlarged during pregnancy, and this enlarged thing is known as tubercle of Monoto-Gomery, as seen in the diagram. Now, parenchyma includes three things: fatty stroma, fibrous stroma, and glandular stroma. Fatty stroma is present between septum and glands. It is distributed all over except nipple and areola. Fibrous stroma consists of fibrous septum extending from skin to pectoral fascia. It is known as suspensory ligament of Cooper, as we can see in the diagram. This is suspensory ligament of Cooper. Now, glandular part consists of 10 to 15 lactiferous lobes arranged in a radial fashion. Near its terminal end, each duct dilates into in the form of lactiferous sinus. Now, we will get started with blood supply of the breast. In blood supply, there is three arteries which supply the breast mainly. The arteries include superior thoracic artery, lateral thoracic artery, and perforating branches from internal thoracic artery. Internal thoracic artery provides blood supply to the branches that run along the sternum, as we can see. Intercostal arteries are the small branches from the rib that contribute to the blood supply of the breast, as we can see here. And internal lateral thoracic artery is a branch of axillary artery that supplies outer part of the breast, as seen in the diagram. Now, venous drainage includes axillary vein, internal thoracic vein, and intercostal veins. So, let's get started with lymphatic drainage of the breast. It is very important topic, as it is asked many times in the exams. So, please focus. The lymphatic drainage of breast includes axillary lymph nodes, which are subdivided into anterior, central, lateral, posterior, and apical lymph nodes, where 75% of the lymph drains. Internal mammillary lymph nodes, supraclavicular lymph nodes. Lymphatic drainage of the breast, lymphatic drainage of parenchyma, including nipple and areola. All the lymph gets drained into anterior and posterior lymph nodes, while it goes to central group. Through central group, it goes to the apical group, and then to the supraclavicular group, and in the end, it goes to the subclavian lymphatic trunk. This is all about the lymphatic drainage of parenchyma, including nipple and areola. So, intercostal lymph nodes gets 5% of the lymph, parasternal lymph nodes get 20% of the lymph, and 75% of the lymph is drained into axillary lymph nodes, which includes anterior group, posterior group, central group, plexus of Sappi, and apical group. Lymphatic drainage of skin except nipple and areola. As we discussed, including nipple and areola, now we will discuss except nipple and areola. The above region goes to the supraclavicular lymph node and infraclavicular lymph nodes. The below 1/4 region goes to the parasternal lymph nodes. It communicates across midline, hence breast pathology becomes bilateral. It goes to subperitoneal lymphatic plexus. Also, it goes to the hepatic lymph nodes, and it can also go to the ovary. And the region this region gets drained into the axillary lymph nodes. Lymph to hepatic lymph nodes can cause obstructive jaundice, and to the ovary can cause Kronberg's tumor. Clinical anatomy. Breast cancer, which is the most common type of cancer in females, usually arises from epithelial cells of lactiferous duct. In breast cancer, three things are seen. Breast is fixed and immobile, also with retraction of skin. It is because of the suspensory ligament infiltration. Nipples are retracted. It is because of fibrosis of lactiferous duct. And the appearance is POD orange-like appearance, means it is appeared like orange. It is because of the obstruction of superficial lymphatics. As we can see in the photo, it looks like an orange. Thank you. I hope you learned something.